Do you know that the number of people living with diabetes has skyrocketed worldwide from around 200 million in 1990 to over 800 million in 2022? And shockingly, in many cases, people don't even know they have it until it's too late. Hi, I'm Dr. J. Welcome to Healthy Living Hub, your source for clear, science-backed health tips. Today, we're diving deep into what diabetes mellitus really is, why it matters, and what every adult should know to stay healthy. What is diabetes mellitus? Diabetes mellitus refers to a group of metabolic disorders in which blood sugar glucose levels remain persistently high under normal conditions. When you eat, your body converts food into glucose. Then a hormone from your pancreas called insulin acts like a key that helps glucose enter your body cells for energy. In diabetes, this process breaks down. Either the body doesn't make enough insulin, or it can't use insulin properly. As a result, glucose builds up in the blood, which over time damages organs and blood vessels. What are the main types of diabetes? Type 1 diabetes, an autoimmune condition where the body's immune system destroys the insulin-producing cells. This leads to little or no insulin production, so people with type 1 need daily insulin treatment. Type 2 diabetes, the most common form, about 85 to 95% of cases globally, happens when the body becomes resistant to insulin or doesn't produce enough. Lifestyle and environmental factors play a big role here. Gestational diabetes occurs during pregnancy and sometimes resolves after birth, but increases the risk of type 2 diabetes later on. How widespread is it? The global picture. As of 2022, the number of people living with diabetes globally rose from about 200 million in 1990 to roughly 830 million. The rise has been more rapid in low and middle-income countries, which include much of Africa, Asia, and Latin America, regions where access to diagnosis and care can be limited. Importantly, many people with diabetes go undiagnosed or untreated. In 2022, a considerable proportion of adults with diabetes weren't receiving medication or regular care. What that means is that a lot of people might have diabetes right now without knowing it, especially in regions with limited healthcare access. What are the health risks and complications of diabetes mellitus? If not well managed, diabetes not only affects blood sugar, it can damage multiple organs and systems over time. Some of the major complications include heart disease and increased risk of heart attack or stroke due to damage in blood vessels. Kidney disease or kidney failure. Prolonged high blood sugar can damage kidney filters, causing kidney disease. Nerve damage, neuropathy, leading to tingling, numbness, pain, and complications, especially in limbs. Eye problems, including vision loss and blindness from damage to small vessels in the retina. Foot problems, ulcers, infections, poor blood flow, and nerve damage increases risk, sometimes leading to amputation. Because complications often develop over years, diabetes is sometimes called a silent disease. Many people might feel fine early on, but serious harm can be happening inside. Can we prevent or delay the progression of diabetes? What research and health experts say? Yes, especially for type 2 diabetes. These strategies have been shown to be effective across many studies and by global health authorities. 1. Maintain a healthy weight. Obesity and excess weight are among the strongest risk factors for developing type 2 diabetes. 2. Regular physical activity. Even moderate exercise, for example walking, light workouts helps. Improves insulin sensitivity and blood sugar control. 3. Healthy diet. Balanced meals, minimal refined sugars or excessive carbs, and avoid obesity triggers. 4. Regular screening and checkups. Early detection allows early intervention, reducing the risk of complications. 5. If diagnosed, proper management. Combination of lifestyle changes, medications or insulin when needed, and periodic monitoring for complications. As a result, many of the serious complications can be prevented or delayed if diabetes is caught early and managed well. What this means for you: awareness is key. Many people may have diabetes and not know. Encourage regular blood sugar checks, especially if there's a family history or risk factors: overweight, sedentary lifestyle, and diet. Prevention is powerful. Simple healthy habits, balanced diet, regular movement, avoiding obesity can drastically reduce risks. If someone has diabetes, early diagnosis and good management diet, possibly medication, monitoring can prevent serious complications like kidney failure, vision loss, and heart disease. Spread education. Share these facts in an easy, relatable way to raise awareness. Many lives could be impacted just by better information. So there you have it. The basics of diabetes mellitus, why it's a big deal globally, and what you can do to protect yourself and your loved ones. If you found this video helpful, please like, share, and subscribe. Also, comment below. Do you know someone living with diabetes? Let's talk about it, share experiences, and build healthier habits together. Cheers!